A group of unemployed doctors will stage a sit-in outside the KwaZulu-Natal Premier's office in Pietermaritzburg today. This marks their third protest action since January. Despite the national government allocating 20.8 billion rand earlier this year to address critical shortages in the public health sector, including funding specifically earmarked for KwaZulu-Natal, not a single doctor has been hired. The KwaZulu-Natal Department of Health has not advertised a single vacancy. The South African Medical Association trade union has expressed concern over the issue while highlighting the National Health Department's lack of strategy. For more on this, we are now joined by Samatu's General Secretary, Dr Cedric Sihlangu. Dr Sihlangu, very good morning to you. Thank you so much for making time for us. What's your concern this time around, considering that this will be your third attempt at trying to get government to listen to your pleas?
Good morning, Edwin, and thank you for having us once again. Look, we're a bit concerned with particularly the government of provincial unity in KwaZulu-Natal, specifically because you'd be aware that at the beginning of the year, we led marches throughout the country, culminating to the march to the Finance Ministry. And that led to, serious budget adjustments. As you've indicated, 20.8 billion being allocated to specifically to the skills in health to absorb all these unemployed doctors. Now, various provinces have commenced the process of, recruitment and, appointment. But for whatever reason, up until now, KZN has not done a single thing. And unfortunately, in the process, numerous attempts through the leadership of KZN, to reach the provincial MECs for health, they would then say, no, it's a provincial treasury issue. There's an attempt to reach the finance, MECs with nothing really, coming forth. And of course, our members in KZN are now very frustrated, which has obviously culminated in, again, another sit-in in the Premier's office, which you also feel the Premier cannot be absorbed as well, because surely this is something that is happening under his administration. It can't be that when other provinces are making strides, KZN is lagging behind, and yet healthcare is still being compromised in KZN. So those are the very serious concerns that we're having. And of course, this morning, our members, the unemployed doctors will be there. Of course, some of us will also be there to support and ensure that really these issues get addressed.
Yeah, and as you said, it's not the first time that these issues have been raised. Last year, they were raised as well, the year before that as well. And I remember the Minister of Health, the current Minister of Health, that is Dr Cedric, saying that government doesn't necessarily have an obligation to hire all the doctors, that it has been part of their training and spend money on their training. But the question in relation to KwaZulu-Natal is that could it be that the 20.8 billion rand that was mooted in the budget by the Minister of Finance, in the delay because of the budget not having been adopted, like we went through budget 3.0, which has now been adopted, the delay in dispersing funds to the various government entities, that could be the reason why the government in KwaZulu-Natal is holding back on advertising those vacancies?
Certainly not. I mean, that would be a convenient argument, but we know for a fact that all other provinces have gone on in terms of, advertising and appointing. Mpumalanga was just doing interviews last week. So, Adrian, we can't have administrators sitting in comfortable government, offices with air conditioners, and they just simply relax when people on the ground are actually, the ones suffering the brunt of a failing system. When something like this was passed, a responsible government, Edwin, would run with it with the highest of speeds. And you don't see that happening in KZN. Even worse, as I've indicated, you get our leaders in the province requesting to meet with the MECs, the HODs, and everyone is parking the buck to the next person. No one is taking responsibility. So that's a problem. But more importantly, which this morning, the Secretary General of SAMSU, which is our student wing, has raised a very serious concern that what is happening in KZN now is that the final year students, those who are just about to become doctors, are now being used as a buffer to be the ones running around as if they are doctors, covering the gaps and filling in the gaps. And we think that that's disingenuous. And it's something that we need to caution very seriously, that using students as free slave labor will not be acceptable. Doctors need to be appointed to do the work, and students must be focused on finalizing their studies and passing their exams. And we cannot have students running up and down as if they are qualified interns and they are working as if they are getting paid. That will not be acceptable.
Yeah, and this takes us back to the debate that ensued following the passing on of a junior doctor, Dr. Aluluto Mazwi. What does this then tell us about the conditions that health workers are working under and the pressure, considering the underfunding of the health sector?
Severely strained, Aldrin. Just on that regrettable moment and issue is that because there's no one on the floor, you might find one doctor covering 4 wards. And if that doctor happens to fall ill, the seniors might say, no, you can't be ill because who's going to see all these patients in the wards, and you'll be dragged back to the workplace, and that's precisely what we've been observing, and of course it's a demonstration or the symptoms of this failure. So it tells you, Aldrin, that if this situation is so dire and critical, surely KZN can't sit comfortably and relax when there's money being allocated and made available. The first thing that ought to have been prioritized is that the moment that this budget was passed, KZN ought to have commenced with the recruitment process, and that hasn't happened. Not a single vacancy has been advertised.
Yeah. What are the current vacancies looking like in KwaZulu-Natal, and with the doctors that will be staging this sit-in? Do you have an idea of the number of unemployed doctors in KwaZulu-Natal versus the number nationally?
Yeah, so currently the doctors that are, going to be staging the sit-in is just over 130, it's approaching 150. Those are the doctors that are out of any form of contract. Now, those are the ones who are obviously based in KZN. Throughout the country, the numbers have been changing, gradually as provinces are advertising. I've mentioned that recently in Gauteng and in other provinces, doctors will be taking up appointment letters. So the number is changing dynamically every day. But what we know, the number that is still unemployed, that is based in KZN, is approaching 150 as of the ones that are going to be sitting in today.
Yeah, and as a closing remark, just quickly speak to us about the health organizations, the World Health Organization's norms and standards when it comes to the ratio of doctor per population per 1,000. I understand that the World Health Organization puts it at around 2.5 per 1,000, but we are currently standing at around 0.3 per 1,000.
Yeah, look, Aldrin, I mean, that's a well-known fact that we are far from, being anywhere close to, what would be an acceptable ratio, doctor-patient ratio. Far from it. That's even, unfortunately, coupled with our inability to ramp up the output of graduates who become doctors. Our numbers are still relatively low. But what is more concerning is that even if you're failing to meet the demands, you are actually, those that have qualified, you are pushing them out of the country. I mean, remember, we just mentioned the statements which were regrettable, that the minister had said that perhaps, some of them can find employment overseas. I mean, that would be obviously the worst case scenario, where now the very little that you have, you've now forced them out because you're unable to offer them employment opportunities. But we know there's been a change of heart there. We don't want any of our doctors to find employment in Europe. We want them here. So what needs to happen, therefore, is the opportunities that are here must be funded so that we begin to have any fighting chance of equalizing the ratio.
All right. Thank you so much for making time for us this morning.